and some simple fixes for them. All right, so 3 things that we want to look at when you're on a bike is you want to make sure that the spinal position and the head position are relatively in a straight line. So from the back of the head down to the tailbone. There's going to be a little bit of rounding here, but the more you can minimize that, it shows that you have good hip mobility. So if the hip is blocked in flexion, there's going to be some rounding in the spine that even if you're trying your hardest to keep a good straight line there, you just won't be able to because you're going to be blocked in flexion. So one of the first things we want to be able to do is clear this hip flexion so that you can get this thigh, not when you're on the bike, but just when you're off the bike, thigh towards the belly without any type of rounding happening here, because that's going to translate to the bike with a rounded position. If the shoulders round and the spine rounds, the head will tend to poke out. So Nick, that's what we don't want to do, is have that chin poke up here. This gets all bunched up in the back of the neck, and you can start getting headaches a lot of times just from having to look up and navigate the environment with shoulders forward and a really overextended upper cervical spine. All right, so we want to make sure first and foremost that we have that clearance and hip flexion. Another test for that would be a full deep squat. Can you put your belly towards your thighs without totally rounding and collapsing there? Okay, so Nick looks pretty darn good with this, and he's got this good neck position. All right, so we want to be able to be strong through the deep neck flexors of the neck, so we can keep a gentle chin nod and not poking out, and most importantly that we have a good straight line down through, and then that the hip isn't translating outward or inward in the internal rotation or external rotation, but it's pistoning up and down. All right, so we're going to get Nick off the bike here and just go over some simple fixes to balance out that, because if you're on a bike for a long enough time, even if you got all your mobility perfect, you're still going to have to get off the bike and balance it out because you're in that flex position. Coming over to the mat here, we're going to start with this supernova ball. First area we want to get at is one of the main hip flexors in the belly. It's called your psoas muscle. So right on the hip bone here, that sticks out the most, and the belly button, right in between those two is where we're going to have Nick lie on the ball. All right, so you can lie on your stomach. So if you're working on the right side, that right leg is going to be extended back, and let's frog out this left leg. All right, and I want you to just kind of rest your right cheek on your right hand, look away from the ball. All right, so now he's sunk in, the ball's up into the belly here, and the breathing is key here. So I want you to breathe in, you'll feel your belly push into the ball. This can be a little nasty, and then on the exhale, just let that ball sink in. All right, so passively we just use the breath to get enough depth so we can actually get to this muscle, which is quite deep. Once you get deep enough, now you can make it a little more dynamic. So I want you to tighten your glute, lift your leg. The knee comes off, and now bend the knee, heel to the buttocks. You're starting to go into some hip extension with some knee flexion. Yeah, you'll feel that. All right, so we can do that dynamically for about 10 reps. The first couple are going to be pretty awful, and then it'll loosen up the more you do. All right, so practice here for about 2 minutes, and then switch sides. All right. How'd that feel? Pretty brutal. So most people, even if they have pretty good hip flexion, which Nick appeared to have on the bike, will still have some restriction in there if they're on bikes for long enough periods of time. So we don't have to look at the other side, but it's the same thing on the other side. Now the other area to look at is this thoracic spine right up in this region here. So again, if that is taking some stress, you're going to have to try as hard as you can to try to maintain this erect position. But the bike really is just promoting this type of flexion through the thoracic spine. So we want to be able to open that up and balance that out. So we're going to take either the Gemini here or something softer, just a double tennis ball type of thing. This is from Soma Systems. So this is a bit softer, same concept. So we'll start with the harder one. Let's get right between the shoulder blades. All right, so next got the word cadence on his back. That's where we're putting this. And he's going to lie right on it, hands behind your head. Try to rest the back of your head and your hands to the ground. All right, so now getting the head down is going to create that extension right over the Gemini there. Important that we stabilize through the midline. So I want you to feel like you're pulling down your belly button. Squeeze your glutes, do a mini bridge. Keep your head down. It's going to go right on that Gemini. It's going to feel like it's you're basically hinging right on the area of the Gemini there. All right, come on down. Don't let the head come up if you can help it. All right, and we do this for reps, so I want you to come on up and drop back down. See if you can think about getting the thoracic region down before the tailbone comes down. Might not happen, but that's what you're trying to do. Segmentally, you're trying to bring the upper vertebrae down before the lower ones. All right, and it should loosen up a little bit as you go, but it's going to be tight. This is supposed to be tight. All right, and if it's too tight, you just go with the lower density type of apparatus, like softer balls. All right, so we got the thoracic area there, so that should open that up nicely. And then we want to look at the back of the head. So a couple different ways to do this. We'll take the softer balls this time, and we want to get right under the bones of the skull, the occipital region, and we're just going to rest the double ball right underneath. Let's have Nick lie back. And what I want you to do is just tuck your chin and look down towards your knees. Take the hands and fold them right on top of the forehead. All right, so you're going to tuck your chin, add a little bit of pressure down, and then the pressure from the ball will help to kind of massage and open up that occipital region, as if somebody was trying to give the back of your neck a little bit of traction. And again, we can do this for reps. We can do it for a little bit of a hold, so holding for 3 to 5 seconds. 10 to 20 reps, or just set a timer for about 2 minutes and just play around with it. So you don't have to put a structure to this. You can just get a sense of things loosening up and change being made. All right, so after that, you can sit up. And you should feel that in the back of your neck feels a bit longer, that these muscles got a little bit of work in here. This underneath the chin here, your deep neck flexors are basically at the core of the neck, so they're your stabilizing structures. And then everything down through here should feel a little bit easier to maintain a straight line. And the other thing to do for the back of the neck, which is my personal favorite for the back of the neck, is using a Theracane here. All right, so we just take these little knobs. So you got a ton of little knobs on the cane here. We bring them a little closer so you can see. You got the hook here, which works well for kind of looping around to some of the upper structures, but what we're focusing on is these little knobs here. And then what I'm going to have Nick do is take the hook here, all right, and you're going to take this little knob up right under the occiput, okay? And I want you to angle it slightly upward, and we're going to bias the right side first, and just find where it feels like there's the most stiffness, so you're going to move it around a little bit, and then I want you to nod your chin into the knob, and then relax it. And you should feel it's giving you a little bit of a lift, but also a little bit of forward pressure. So you can actually mobilize the joint. It's sort of like a mulligan mobilization with movement, or a snag where you're kind of going upward with the facet joint. Okay, so chin nods, you're getting those deep neck flexors firing while you're getting a bit of mobilization and deep pressure release from the cane. So 10 to 20 or about 2 minutes, just work it out. Always retest afterwards. Might feel good when you do it, then you retest and you actually feel worse. Well, it's not something you want to do again. All right, so we got upper cervical spine, thoracic spine, psoas, trying to improve this full hip flexion. It'll make your biking a lot easier. Your performance will improve and your risk of injury will go down. See you next time.